Hello, insiders. This is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. Today, we are talking about medication menaces, specifically statin drugs, which are prescribed to lower cholesterol. And as usual, we are going to look at the drug information that is sent out by the drug companies. I'm going to pick Crestor just because I pick a random drug in this classification, but anything that I say about this specific drug applies to all statins. And then we will go to our askapatient.com to look at actual patient reviews that have been on the drug for a short or long time. And then we're going to look to see what the experts are saying. First of all, I want to I want to read you an excerpt from this book, Overdiagnosed by Dr. Gilbert Welch. I mention his statistics and quote him as one of my 101 footnotes in Stealth Health. Dr. Gilbert Welch has been outspoken in his books. He has two of them. This one, Overdiagnosed, and also Less Medicine, More Health. And he's been outspoken about healthcare question marks he has. Like, why do we do things like this? If this is really related to health and wellness, I'm seeing this statistically. Why are we doing that? Interestingly, he lost his license to practice over the last few years since 2020. And he is a statistician. He loves to look at numbers, and he loves to look at raw data rather than what the media tells us a research study is saying. And he was a physician with the VA for his whole career, lost his license. I'll have to look to see what's happening now with Dr. Gilbert Welch, because some of the people that were outspoken during the last few years and weren't, quote, following the science, lost their licenses, but some of them are getting them back. So I'll check that out and let you know what I see. So this is Dr. Gilbert Welch's book, Overdiagnosed. I'm reading from page 21. So this is the very beginning of his book. And he writes in a style that is very entertaining and actually laugh out loud. So if you have any interest in this kind of stuff, I highly recommend getting his books. One of the things I know from doing my research for Stealth Health is that the lowering cholesterol frenzy started when the soldiers were returning from World War II and into the United States, and they had been put on those K rations. This is the first time ever that K rations were used, and they did a study on these soldiers when they returned, and it was actually a faulty study. The outcome of the study didn't support the data that was collected, and that could be a whole nother podcast episode. But I'm going to dive into where Dr. Welsh picks it up. And he says that prior to the mid 1990s, normal cholesterol was considered anything below 240 for a blood test for your total cholesterol. But in 1998, a major randomized trial changed things. They then considered normal cholesterol to be anywhere from 228 to 184. So, and he says over 5 years, about 5% of patients with untreated normal cholesterol had one of these events, while only 3% of patients treated with treated normal cholesterol did. Thus, the chance of benefit from giving cholesterol-lowering medications to a broader group of people was 2%. For every 100 patients treated over 5 years, 2 were helped and 98 were not. So all of a sudden, the threshold for abnormal total cholesterol fell from greater to 240 to greater than 200. This change affected a lot of people, meaning an additional 42 million new cases of high cholesterol were diagnosed. 42 million people in 1 year. You might reasonably wonder why so many people were affected. Now, the cholesterol of 200 is almost right in the middle of the normal range. So moving the cutoff to 200 or below as being normal had a huge effect on the number of people diagnosed. And what does that do? Who does that benefit? Does it benefit the people involved? No, because for every 100 patients treated over 5 years, 98 showed no benefit and only 2 showed a benefit. So, but what it does benefit is the drug manufacturing companies. Are we surprised by this? No, we are not. We are savvy to this now, right? Because we are stealth health operatives. I'm going to share screen with you. And let's see, we are going to go to um, this screen here, which is from the Crestor website. Crestor side effects. I'm not going to read you this whole page, but predominantly muscle pain and tenderness and muscle actual weakness because this drug causes muscle tissue breakdown. So it's not just the inconvenience and discomfort of pain. This drug is actually causing the muscles to break down. The other one is liver problems, but you might think, oh, I don't even know what my liver does or where it is. Well, your liver does 1,000 different things for you on a daily basis. So and the most predominant thing they say that you should let your doctor know right away about is if you feel unusually tired or weak, the loss of appetite, if you have pain, dark urine, or yellowing of the skin. But the liver does many other things that could be happening without your awareness. Other common side effects are headaches, muscle aches and pains, abdominal pain, weakness, and nausea. Oh, and memory loss and confusion. And we're going to circle back to that. Also, protein and blood in the urine, which probably indicates something bad. An increase in blood sugar, meaning glucose levels. So, this is called prediabetes. So, taking a drug to lower your cholesterol when your cholesterol is not high in the first place could actually lead to a diabetic state. Doesn't sound great to me. Let's look at the Ask a Patient website. So this is askapatient.com, and I put in Crestor. You can put in the name of any drug you want. You can search for any medication. And these drugs are rated by users from a rating of 1 to 5, 5 being just honky-dory and fine. Rating of 1 is very low. Let's scroll down. Oh, and the average rating is 1.7 for Crestor. And you know what? Try this out and look up some other drugs like amoxicillin, which is an antibiotic that's been used for decades, or penicillin. Look that one up, and the ratings will be actually close to a 5. So here we are. Now I'm going to just read to you the side effects that people notice from Crestor. This one, muscle weakness, soreness, forgetfulness, had to quit due to cramps, abdominal cramps, and leg cramps, elevated blood sugar. This one said no side effects. Pain, and this one's pain in the hand and back, progressively higher A1C, now pre-diabetic. Lovely. Fatigue, wellness, muscle pain, pins and needles in the right hand, brain fog, depression, lack of interest. And he was taking it for 6 months. Over here, I'm looking at the lowest dose, 5 milligrams once a day. This next person gave it a 4. They had no side effects because they said it was a small dose. This one, no side effects. Now, this person decided to take a CoQ10 supplement along with it, which is actually very smart. This one, constant chest tightness, getting bad out of breath, dry eyes, memory problems. This one, swollen in hands, fingers, arm, burning in the chest, headaches. So the list goes on, and there's a lot of people rating this 1s and 2s. So So you can see that the rating on this is low. So, okay, what do you do? Well, first of all, we just established that until 30 years ago, having a cholesterol rating of 240 or below was perfectly fine. So, and I would like to present to you, I'm not a cardiologist and I'm not giving you healthcare advice, but I would present to you the possibility that perhaps if your cholesterol is 240 or below, you could be normal. But I'm going to give you another person's a cardiologist's opinion about that in a moment. The other thing I would like you just to observe is that um, although more and more people are on this medication and it is a preventative medications, do you notice more and more people being free of heart disease? Do you notice more people being able to do more with less medication, with less interventions, with less testing? Or are you noticing, like I am, that people are sicker and sicker, and there's more interventions, and there's more dialysis centers, and there's more medical care facilities going up? I don't know. What do you notice? I'll share screen again. And I am here at an article that was published on the HeartMed Institute, or HeartMD Institute, sorry. This is Dr. Steven Sinatra, and he wrote a book about heart disease, which changed one of the people I wrote a firsthand account about in the book Stealth Health. Um, who was immediately put on 7 medications when he had a heart attack and got himself off of that. So he turned me on to Dr. Steven Sinatra's book. So here we go. In June 2011, the Food and Drug Administration issued a warning about the increased risk of muscle pain and muscle weakness from high doses of Zocor, which is another cholesterol lowering statin drug. Now, Dr. Sinatra feels like this was a good thing that they were issuing a warning, but the fact is, he states that statins can contribute to memory problems, cognitive difficulties, which cognitive decline, I call one of the 3 C's that Americans are afraid of: cognitive decline, cancer, and cardiac issues. But the same drug also contributes to cataracts, liver problems, polyneuropathy. That means problems with pain, numbness, tingling, weakness in the extremities like hands and feet, impotence, also called ED, and immune decline, which is not good. The basic trouble is that these drugs inhibit the body's production of CoQ10. What the heck is CoQ10? Oh, it's just a vitamin, whatever. No, CoQ10 is an essential part of your body's ability. Every single cell in your body has to produce energy in the form of ATP. ATP equals energy for the cells of your body. And if you don't have enough CoQ10, your cells cannot produce more cells. So you'll see a loss of muscle, a loss of skin, and your heart is the one organ that is working and pumping every day, all day long with muscle tissue. Muscles use the most ATP, and the heart muscle especially has got to get the most CoQ10. So ironically, if you're taking a statin drug to prevent a heart attack or stroke, and your body is not getting enough CoQ10, you are going to end up with heart issues. So he goes on to say also that cholesterol is absolutely critical to the body in so many ways, including as an essential raw material for the cell membrane. Now, the cell membrane of the 40 quadrillion cells in our body, the cell membrane is what lets toxins out and lets nutrients in. If the cell membrane is faulty, you will have faulty uptake of nutrient, and that will lead to early aging and disease, pain, and and just not feeling good, and also a potential for dementia because of these cholesterol drugs. Oh, and sorry, I meant to say, and also sex hormones. Now you would think, well, I'm old, like, what do I need that for? No, your reproductive and sex hormones are intricately related in your body's ability to feel joy, to feel compassion, to feel connection with others. Also, our body's ability to have stamina, a drive. This all comes from our sex hormones. It's really the essential things of being a happy human reside in our sex hormones. Dr. Sinatra goes on to mention some specific studies, some research studies, and he mentions a 2010 review by British researchers, and they did what's called a meta research on. They went to look at other research studies, 11 major studies, which involved more than 65,000 different patients, and they failed to find evidence for the benefit of statin drug therapy for high risk prevention. And the Beatrice Golomb, the MD, who's a statin expert from the University of California, commented that the study supports what we should already know, that for patients without heart disease, statins are more risky than helpful. And then another study in 2010, this was from databases of 368 general practices in the UK with more than 225,000 statin users. And what I like about this study is there's so many people in their group that they were studying. Researchers found significant associations with myopathy, muscle pain, cataracts, renal failure, which I linked to all the dialysis centers that we see in the United States, and moderate or serious liver dysfunction. You want to feel really sick? Have serious liver dysfunction. Then Dr. Sinatra goes on to talk about this study that was done about Crestor. And these persuasive papers were written by, let's see, this cardiologist, Dr. Logeril, MD, and he's from the French National Center of Scientific Research in Grenoble. He challenged the results of a highly publicized Jupiter study. So if highly publicized, that means you would have heard about it on the news, on the internet news engines that pop those news stories up for you, whether you want them or not. And his report pointed out that 9 of the authors of the Jupiter study had a financial relationship with AstraZeneca, which was studying the outcome of Crestor's ability to decrease the risk of developing heart disease. And this medical doctor, he also critiqued that that the most published cholesterol-lowering drug trials since early in the 2000s have been negative or ambiguous. But you know what? Those don't get broadcast on the news because why would they? What good would that do for the drug companies? So the bottom line for Dr. Sinatra in this article is 2 significant things that I want you to pay attention to. One is that the emerging evidence clearly shows the importance of inflammation over cholesterol. And the statins could excel when used in high-risk patients with known heart disease. And these are specifically males with a low HDL and established coronary heart disease. However, and I'm going to pause for a moment so that you really listen to this. Women with high cholesterol, and I'm going to put high in quotes, high cholesterol, in the absence of coronary heart disease, have no business taking statins. There is no evidence that drugs do anything for them. Let me say that again. Women with high cholesterol have no business taking statins because of the side effects, is my assumption. But what he's saying is that there's no evidence that the drugs do anything for women with high cholesterol. I'm going to go to the next article here, and this is also from Dr. Sinatra. And he talks about the confusion with cholesterol because your medical doctor is telling you one thing, and the media is supporting that idea if you watch the news or listen to the news or those pop-up newsy pieces. And then Dr. Sinatra is saying something different, as am I saying something different. And what he also talks in this article is that there's other members of the system at work here, not only the pharmaceutical companies, but also the food industry pushing low fat diets. And the low fat diets typically are recommending or are offering, not recommending, but offering sugar laden inflammatory foods. And he also mentions regulatory agencies such as the FDA and medical organizations. So he is talking the system right here. What you don't hear very often is about a population a study in France, and the French people are notorious, have the highest level of cholesterol, blood cholesterol in Europe, about 250, but the lowest incidence of heart disease. And also, a 10-year study on the Greek island of Crete failed to record a single heart attack despite its participants having an average total cholesterol well over 200. So, cholesterol may not be the thing that we should worry about. It should be the specific type of cholesterol. And this is what I want you to listen to as well. Going beyond the typical blood test, just giving you the LDL and the HDL, Dr. Sinatra talks about this lipoprotein particle profile, LPP, which is a test that dives deeper to look at the small LDL, and he wants you to also monitor your homocysteine levels. So here's the thing. So when the LDL, this is specifically the small LDL, goes to repair a blood cell wall, it creates inflammation. And what he wants you to know, this remnant lipoprotein works the same way, but it doesn't create oxygen. It doesn't oxidize, so it's not picked up on most blood tests. It simply enters your blood vessel wall and starts to inflame. So his recommendation is ask your doctor to do a follow-up with VAP or that LPP test that clarifies your individual cholesterol fractions. He says if you're a male up to age 75 and have heart disease, and this LP test shows that you have predominantly small LDLs, then it's a good idea to go in the statin drug. And I'm showing this on my screen so you can read it as well. Statins also have a strong anti-inflammatory property, and that's the powerful effect you're looking for. Now, if you're over age 75, don't get the statins because the drugs have too many downsides in this age group. And he mentions in this article as well, if you're a woman and do not have unhealthy levels of inflammatory markers, those being three things: homocysteine, fibrinogen, and C-reactive proteins, do not go on statins. So, and he does say, however, if you are a female with arterial disease and your cholesterol profile includes high levels of small LDL, that means you have to get that special test, the LPP, and you have other inflammatory markers, a statin may provide you with the anti-inflammatory agent as a means to reduce blood viscosity. So you can see that it is a lot more, there's a lot more information you can get by being your own best expert. You're asking for a specific blood test so you have a choice to make, which I talk about in Stealth Health. If you're presented with a blood test or any other kind of test, you're asking if something shows up as positive, as there, what are we going to do? If something is absent, then what are we going to do? And that should be two different answers. It should show you which direction to go. So I hope this has been informative, and I hope it's shed some light for you on these dangerous statin drugs and how they should be used very specifically, not for everybody. As always, my hope for you is that with each passing episode, you get closer to being your own best expert. Bye for now.